Every September, experts gather at the world's largest lung cancer conference to share the latest advances in treating a disease that is known to many as fatal illness. But in recent years, there have been incredible scientific advancements that have led to new ways of treating the disease and new hope for patients. A big problem is that people are usually diagnosed in later stages when the cancer is hard to treat. Here to explain what's being done to help the roughly 43,000 Americans diagnosed with stage 3 non-small cell lung cancer each year, and to share some of the latest advances is Dr. Edward Kim, chair at the Department of Solid Tumor Oncology at the Levine Cancer Institute. Doctor, what are the challenges surrounding a lung cancer diagnosis and treatment?
It's always challenging when a patient is diagnosed with any cancer, and especially lung cancer. Those are the patients that I see. They feel devastated, they feel anxious, and it's very, very tough on them, their family, their friends. I think cancer evokes that emotion more than any other disease. The good news is that once we get past the discussion and the initial diagnosis, we need to start talking about treatments and what someone needs to do to prepare themselves for that. There is a lot of new hope right now in lung cancer. The past 8 to 10 years, numerous drugs have been approved for lung cancer that have really changed how our approach is to patients who are diagnosed.
Some of the most exciting data at the World Conference on Lung Cancer is focused on unresectable stage 3 non-small cell lung cancer. Can you tell us more about this type of disease?
Stage 3 unresectable non-small cell lung cancer is an in-between disease. In the early stage, stage 1 and 2, we can usually cure the patient with surgical resection. In the stage 4 setting, that's when the tumor has spread outside of the lungs to other organs, and we can't cure those patients with that diagnosis, but we do have lots of treatments that have helped improve their quality of life as well as prolong survival. Stage 3 can either be approached with surgery or non-surgery, and the majority of these patients we can't do surgery in because the tumor is in a position where it's spread locally to lymph nodes or other structures. In those situations, the unresectable stage 3 non-small cell lung cancer, we give chemotherapy and radiation together. This is what we've been doing for the past 20 some odd years, and with some modest results. What do I mean by that? Many of these patients, after we give them this curative intent therapy, their tumors come back. And when they come back, it's been very challenging to treat them. What has been new and exciting is that for the first time in this setting, stage 3 unresectable non-small cell lung cancer, we have a new drug that's been FDA approved, and that drug is durvalumab or Imfinzi. The Pacific study, which was sponsored by AstraZeneca, and I do consult with AstraZeneca as well as some other companies. The Pacific study utilized durvalumab or Imfinzi after concurrent chemoradiation, and those patients were found to have decreased significantly amounts of tumor returning, and most recently at the World Conference on Lung Cancer showed an overall survival benefit. Patients live longer when they receive the durvalumab. Now again, there are some patients who are going to have side effects or who have pre-existing medical conditions and they can't receive durvalumab or Imfinzi, but the new standard of care, what you should be discussed with your medical professional, is chemotherapy and radiation followed by durvalumab.
It sounds like early detection can be critical. How would someone know if they might have lung cancer, and what are some of the common symptoms?
It's very tough to find early detection in lung cancer. We base it right now on a history of smoking, if you've had 30-pack-year smoking history, and if you're greater than age 55, then we encourage you to get a CT screening test done. Otherwise, they're really nonspecific, like cough, unexplained weight loss, you could have some pain, but these are not any one key indicators to say, oh my gosh, that could be lung cancer. It is almost an invisible disease. You don't feel a lump or you don't feel masses, and so it really is important to get screened, just like you would get a mammogram or a colonoscopy. A CT screening test is very important in those patients at high risk. And then if you're diagnosed, just know that we have more options, we have more therapies to help you.
What would you say to patients diagnosed with stage 3 non-small cell lung cancer?
Yeah, what I tell my patients who I see who are diagnosed with stage 3 unresectable non-small cell lung cancer is that we have a new standard of care. It's chemotherapy and radiation followed by durvalumab for 1 year. Now, again, some patients can't receive that because of side effects or pre-existing medical issues, but this is the new standard of care that exists for those patients. And this is the first time we've had a new standard of care with an immunotherapy, even more importantly, in this patient population. And that's what excites us, that this may just be the beginning of what we can build upon through research, through clinical trials, finding even better solutions for these patients.
Doctor, I'd like to thank you for taking the time this morning to talk with us. Have a good day.
Thank you. You too.